So doctor, I have hyperpigmentation around my mouth, and a lot of people told me that licking your lips causes hyperpigmentation. Is it true? What is the science behind it? I mean,
so this is something known as lip lickers dermatitis. It's also known as lip lickers eczema, because what happens is when you lick your lips a lot, there can be dermatitis, which is an inflammation of the skin around the area, which is initially red, and then because the inflammation also has a post-inflammatory hyperpigmentation phase, that is what you could be seeing as darkness around your mouth. So of course the best thing to do is to avoid licking your lips, and if you're doing it because of dryness, then you can just use a moisturizing lip balm instead.
So doctor, I have pigmentation on my under eyes as well, dark circles. Is there a way to treat them? So my dark circles are hereditary. Let me let you know in advance. Is there a way to treat it?
So as you said that your dark circles are hereditary, right? So similarly, there are many causes for dark circles, right? Whether it can be hereditary because of deep set eyes, okay? You could have this bone a little bit in front and this a little bit behind, because of which the shadow will create a dark circle. You could have atopic dermatitis, where a lot of the times this entire area has inflammation, and because of that they have post-inflammatory hyperpigmentation. You could be allergic to some makeup that you're applying. You could be allergic to some eye drops that you're applying. You could just be rubbing your eye a lot, right, which also causes it. And of course, having an irregular sleep cycle, staring to screens late at night, eye strain, all of that is also going to cause dark circles. So it has to be treated according to the cause. If it is genetic, or if it is due to deep set eyes, then the best thing you would have to go in for is procedures. Now that procedure can be a filler, it can be a thread, but you would have to go in for something like that. If you don't want to do that, then you would have to use retinol based creams, which will over a period of time stimulate collagen synthesis, but it's only a minimal result. You're not going to get a filler kind of effect. If your dark circles are due to an irregular sleep cycle, you already know what to do. If your dark circles are due to atopic dermatitis, that would need to be treated.
There's one more question that arises a lot of times. What do you mean by pH level of your skin, and how does it matter in makeup and skincare both?
So pH levels of your skin and like every other thing has a pH value. Okay, so the pH for facial skin and in general skin is 4.7. Now when you apply, let's say like we all used to earlier, use soap. Now we know that soap is basic pH, right? So when you use something that's basic to wash your face or wash any other part of your body, which is normally acidic, it's going to disrupt the pH, which is going to over a period of time lead to an impaired barrier. So which is why the dryness and the cleansing effect that we get from a soap is very difficult to achieve with anything else, but that is actually your barrier starting to fail. So you need to make sure that you're applying pH level products that have a similar pH to the skin, and that would be best for you.